Yat masana ena tishje ya jedi hashin soba kunen zinigi ben hilwadilne.
Nam snijene is ding ko le shata ade ko shinan sni. Donani yoligita nani yoligi is besnani yolne june ko shin betrahon da je ko shin betletje jiho. Ko je khatani charge bitsado je ding. Polgehina nasnijene hotuk oyo unstel kosha adoshi til koshi nebedes das na lahlen shi hotado nalabet nabetitla shalin ako kollegin nadel betro nadel lan shebejo alo betchita eshi bedesnila akot an ni trahans ni adoste tanto to kot egi to nanas nita akonda das kashita eshishite tatalnasto atinde ayat ana no na hadlen jotini yoligi da shi to shat ida da le ni ki yot to nana le shata adot le khata git na shan bide pesh adot zakunda eshi da chit besni yod kota be jole shi kota besni yod eshi tot jo no aya da ne shan ye do shvoye ako kot egi bedesnit joda nint ko ni khana na lia ni shashan ako kot ege kadon to sa na kinada do na ni do ni shumashanen de be jada chachaya chi to be jende joy hwet de go ndash khai ko shi ad to sni shi Asian the posh 1 year the New York snooze. So I didn't know still in the other I didn't know the shoes. What
The Navajo people were exposed to tuberculosis at Fort Sumner. Upon returning to Navajo land, they brought back tuberculosis. In 1912, 10% of the Navajo people had tuberculosis. In 1925, 25% of the people who had tuberculosis died. In 1938, at Fort Defiance, there were 343 patients, of which 230 died. In the 1950s, Cornell physicians under Dr. Walsh Dermott began INH trials on the Navajo reservation. Surveys of Navajos with tuberculosis since 1913 to 1920 have shown percentages ranging from 2.4% to 14.5%. During this same time frame, it was determined that the Navajos living in Western Navajo had the largest percentage of active cases of tuberculosis, 6.4% to 28.7%. The death rate from tuberculosis is as follows. In 1907, 175 Navajos per 100,000 died of tuberculosis. In the late 1930s, the peak was at 386 Navajos per 100,000. And in 1975 to 1977, there was a dramatic drop to 6.8 Navajos per 100,000. The Navajo Nation tuberculosis disease infection has been fluctuating from a high of 27 per 100,000 to a low of 3 per 100,000 from 1990 to 2010, according to the CDC and the Navajo Nation Indian Health Service. The Navajo TB rate is 32% higher than the United States rate from 1990 through 2010. In 2005, the Navajo Nation TB rate is 10% lower than the United States. However, since 2005 to 2010, the Navajo's incident rate of TB has been increasing in comparison to the United States.
Winika was the first woman elected on the Navajo Tribal Council in 1951. Her primary goal was to get rid of tuberculosis among Navajo. She traveled across the reservation visiting the ill and encouraging those with tuberculosis. She was awarded to the Presidential Medal of the Freedom from John F. Kennedy in 1963. Annie studied TB disease at Fort Defiance TB Sanatorium. She made home visits to educate the Navajo people about TB germs in the body. TB rate decreased on Navajo Nation through her education. She educated medicine men about tuberculosis. What is tuberculosis? Tuberculosis is a disease caused by a bacteria called Mycobacterium tuberculosis. TB bacteria can attack any part of your body, but they usually attack the lungs. How is TB spread? Spread through the air from one person to another, airborne. TB germ is spread when a person with active TB coughs, sings, speaks, and you breathe the air contaminated with TB germs. What are the signs and symptoms of TB? Feel weak or sick, lose weight, fever, night sweat, no appetite. If their disease is in the lungs, they may also cough and have chest pain and cough up blood. TB is not spread by shaking someone's hand, sharing food or drink, touching toilet seat, sharing toothbrush, or kissing. Get your TB skin testing. Purpose is the technique for controlling and preventing TB. Identifies and treats person with TB disease, identifies and screens contacts to TB cases, and screens population at high risk for latent TB infection and TB disease. Active.
The tuberculin skin test is to determine if you have ever been exposed to TB. A small amount of TB protein is injected just below the top layer of the skin of your inner forearm. Healthcare providers must read test results within 48 to 72 hours, or you will have to be retested. Do not irritate the injection site. Scratching will make your test result hard to read.
Drugs used for active TB infection: isoniazid, rifampin, ethambutol, pyrazinamide.
If your skin test is positive, get a follow-up test, chest x-ray or sputum culture. Follow doctor's advice, take your medication. TB is treatable and curable with medication. Treatments last 4 to 12 consecutive months. TB can be stopped. Let's stop the spread of TB. Let's fight the TB germs and win.